We're here thanks to the mayor and celebrating Organ Donation Week here in the great city of Lynn. My name is Matt Boger. We represent, along with Jim Rodrigue, the federally designated Organ Procurement Organization, OPO. It is our responsibility each and every day to help save and enhance lives through what I call the miracle of organ donation. We're here to thank the state in many ways. A, for creating this wonderful billboard that we have several places throughout the state, including Springfield. And this one is on the Linway Rotary, is that the right term? On Route 60, educating people and encouraging people to say yes when they register at the RMV, when they get their driver's license, ID, or real ID. The RMV is here, and again, the vast majority of people who register do so at the RMV. In fact, that statistic is over 90% of the population. Valerie, come on in. Who register as organ donors do so at the RMV. Mayor, thanks so much for coming here and turning on the wonderful sunlight in a little bit of a hot day to celebrate organ donation, to proclaim Organ Donation Week in Lowell, and then in Lynn, and then to raise the flag. Thank you for your time. Appreciate that.
Thank you so much. Thanks everyone for being here. I am honored to share this official City of Lynn mayoral proclamation, whereas there are more than 900,000 Americans with more than 5,800 in New England who are currently waiting for a life-saving organ transplant, and whereas there are over 1 million life-enhancing tissue transplants each year that are made possible by the generous donation of corneas, bones, skin, or other tissue, and whereas we can all help save up to 8 people's lives and benefit up to 50 recipients by signing up to become an organ and tissue donor by enrolling in the Massachusetts Donor Registry when we apply for or renew our driver's licenses, ID, or real ID by registering online at mass.gov/organ donor. Whereas 97% of all people in Massachusetts who register to become a donor do so at the Registry of Motor Vehicles, it is fitting that Massachusetts seeks to surpass the national goal of signing up 50% of our driving population to become donors, and is dedicated to making it fast and easy to sign up to save a life through our Registry of Motor Vehicles. And whereas this observance pays tribute to organ and tissue donors and their families whose decision to donate life enables others to receive life-saving organs and tissues for transplant, and whereas during National Health Center Week, we celebrate the legacy of community health centers across the United States and the impact that these decisions to donate life-saving organs makes on our community. Therefore, I, Jared C. Nicholson, Mayor of the City of Lynn, hereby proclaim August 27, 2024 as World Organ Donation Day, and encourage all citizens of Lynn to take cognizance of this event and participate fittingly in its observance. Thank you.
Thank you, Mayor. Really do appreciate that. Very important. And again, thanks for everyone who's attending. We have Natasha, who's a city council member here, and then the wonderful police of Lynn here just to support the cause. Thank you for your time on that. And Mayor, again, thank you for organizing that. The mayor mentioned a couple things, and I do want to welcome the staff of Lynn City Hall. Thank you so much for coming here as well to bring attention to the work you do each and every day. Standing here in kind of the city of Lynn is a busy, vibrant place. I met a friend here who just came over and talked to me, and I met about 4 other individuals. This community has a massive heart, and we're here today to talk about the heart, getting this heart on your license, being here for 2 minutes here in the city of Lynn. This city has a lot of heart, and they want to reach out and learn about you, and I take great pride in that, so thank you so much. The mayor did mention there are several ways to register. First and foremost is at the RMV. Second, I want to thank the state once again of creating a specific website mass.gov/organ donor to register as an organ tissue donor. Now, registering as an organ donor is a voluntary choice. That being said, it's not a neutral choice. Both the state and federal government strongly support organ donation and puts it on a state document in Massachusetts, throughout New England, and throughout the country when you get or you renew your driver's license, ID, or real ID. This is strongly supportive, and the idea of registering as an organ donor is not necessarily becoming an organ donor, it's about providing hope for those in need. Right now, there's over 106,000 people in the United States waiting for a life-saving organ. In New England, there's over 6,000 people waiting for a life-saving organ. In Massachusetts, there's over 4,000 people waiting for a life-saving transplantation. We're here to provide that hope. We're here to acknowledge the legacy of the donors, and we're here to encourage people to get the heart on your license and to realize that you're more likely to need an organ than to become an organ donor. Now, I know people watch Grey's Anatomy, and I'm a little old ER, and everyone is aware of organ donation. It's a very, very rare occurrence. It does not happen often. Someone else passing away can save someone else's life. And again, our motto is donate life, wherever that is, up there. We don't want anyone to pass away. That's a zero-sum game, but an individual passing away and saving someone else's life is the true gift of humanity. We could not do what we do without the help of all state agencies, but specifically the RMV. And I'm so pleased to have Jay, who is one of the leaders at the RMV, talk about organ donation and the wonderful work that he and his staff do each and every day, presenting that voluntary choice. Would you like to register as an organ donor? Jay, thanks so much for coming. Appreciate that.
Thank you.
Actually, I've got your cup too. Look at that.
Look at branded. I love it.
Yeah.
So it's a pleasure to be here with everyone today in the great city of Lynn, representing Registrar Colleen Ogilvie, whose relationship with Matt means the world to her and to our agency. We have that ability that not many can. We can say we save lives by asking one simple question. And Matt, I understand we have some work to do to get Massachusetts on top. So that's my commitment. We're going to be #1 by the end of the year in the United States. That's what we're going to do here. I've been doing a lot of these with Matt over the last 5-6 years, and it wasn't until recently that I'm able to look at it through a different lens. My brother-in-law passed away suddenly in March, and he was an organ donor. And for several medical complications, he was only able to donate his cornea. But I have the pleasure now, and it brings me great pride to say that I know someone somewhere is looking through the world through my brother-in-law's eyes. And that can only happen when you're an organ donor. So when you come to the registry, we'll be asking, would you like to be an organ donor? Click yes, say yes, and we'll continue to save lives and build this wonderful partnership. Thank you all for being here today.
You've always good, but you make it better and better each time.
I appreciate it.
Our privilege to work with the RMV, which again sees the vast majority of people in the state of Massachusetts and in every state, presenting that question is a great value to us. So we appreciate the wonderful work they do each and every day, serving thousands of people and asking that question. They do a great job. Now, kind of what we're here for is to hear people personally touch. And Mayor, I want to thank you again for inviting your wonderful staff to come here and celebrate this event. That is very kind. And again, this is something with healthcare. Everyone wants to do something. This is an easy lift. This is just registering as an organ donor. The amount of people who come and say, listen, I've got the heart of my license is wonderful. I'm not shaking people down about that, but I'm sharing that the importance of being part of something that's bigger than yourself, something that's positive, something that could help save someone else's life is great. People don't think about organ donation until it kind of lands in their backyard. And the people we have here today have been touched by organ donation. I'm so thrilled that they're able to share their stories. Bob, I met because I saw a picture of him and his wonderful wife at Disney World celebrating, and he's here to share his story here. So thanks so much, Bob. Really appreciate you coming.
Good morning, Mr. Mayor. My name is Bob O'Brien. I'm a heart transplant survivor. Here with my wonderful wife, Julie, who's grew up in Lynn. And we just wanted to come and explain how important donation is. My story started in 2007 when thought I was healthy and had a massive heart attack while on vacation. Had to go through a whole lot of things, a heart bypass surgery, and I stayed sick until 2012 when I was put on the transplant list. I stayed on the list for 10 years, and finally in June 16th, 22, I was blessed with a new heart. Since then, I tried to contact the family. I sent a letter. For whatever reason, I didn't hear anything back. But my main message to them was I just wanted to thank them, because if it wasn't for their generosity of the family, I wouldn't be here. Plain and simple. I was passed over for a heart a year prior because it wasn't a good heart. But I've had my heart donor on my license since I've had a Massachusetts license. I grew up in Massachusetts. I served in the military for 20 years and retired. And then I thought I was moving on with a different career path, but times change. But I am so thankful to the family to take the time. And thank you for coming.
Bob, thank you so much for sharing your story, for your service in the military. And you're a great example that if you saw you walking down the street, you would never know that you had a fairly significant surgery, a heart transplant. And for you to say, I want to thank my donor's family, because I know that they miss him or her each and every day and have a lot of pain about that. But for them to realize out of something tragic, something great, something miraculous happened is what it's all about. And I do know that Julie attended high school here and might have gone to school with one of these officers here. He might be hiding, in fact. He's hiding, okay. But a lot of connectivity to this wonderful city of Lynn. Organ donation, there are two sides of that story. There's the people who've received that and live each and every day with great pride and joy in realizing they got a second chance. And then the other side of families who've lost loved ones, hurt each and every day, but realize that their loved one helped save someone else. And Carol's here to share her story. And again, we really appreciate her time here. And she's a former nurse and a really thoughtful person. So thanks so much for coming, Carol. Appreciate that.
Good morning. My name is Carol, obviously. Sure. And first of all, I'm not a nurse. Anyone that sees this sees me saying that. I was the admin assistant for emergency physicians in Lynn for years. And I grew up in Lynn and went to high school right across the street. But we raised our family in Salem. And my story actually begins way back in 1983 when my son Scott was a junior at Salem High. And one night, on his way out to driving school, he said, "Mom, if anything happens to me, I would like to be an organ donor." And I actually remember saying, "Oh dear Lord, I don't even want to think about it." But we did all sign up for organ donation for a good many years, never thought about it again. Now move ahead to April of 1999. Scott is married, an Army intelligence officer with two beautiful sons, Christopher, 2.5, and Ethan, 11 months, and they're stationed in Monterey, California. And while we were having a wonderful Easter vacation and visited with them to a redwood forest, as Ethan lay asleep with his head resting on Scott's shoulder, I remember a sudden gust of wind, people screaming, and a falling limb of a giant redwood tree hit Ethan in the head. And in that split second of time, our lives changed forever. MedFlight flew Ethan to Stanford University, where he received the most wonderful and compassionate care. I believe that God always answers our prayers, but I also know that we don't always get the answer we want. We continually prayed for a miracle that Ethan would live and be the same happy, beautiful little boy he was when he woke up that day. However, after 3 days, the pediatric neurosurgeon explained to us that Ethan was about to be declared brain dead. and that his mom and dad had chosen to donate Ethan's organs. And we were so very proud of this wonderful decision made by our two heartbroken kids. And suddenly, in our darkness, a light shone. And in our pain, there was a feeling of peace. Again, we prayed, but this time we prayed that a recipient would be found. Later, we were told that Ethan's liver would be going to a little boy from the Northwest, and his 2 kidneys would travel east to a 55-year-old man. And immediately, it felt like the sun came out with a beautiful rainbow in the middle of a terrible storm. Finally, something wonderful would come out of this terrible tragedy. And then we brought Ethan home to New England, where he's buried next to my mom. It was sometime in the year that followed, in my grief, when I realized that on that same Easter weekend, while we were praying for Ethan to live, the families of those 2 recipients were praying fervently for their loved ones to live. And our Ethan was the answer to their prayers. And how blessed were we to have had him in our lives for that short period of time. In retrospect, I now realize that every decision we made that day put us exactly where we were supposed to be at that one moment in time. It's been 25 years since that tragic day, although at times it still feels like yesterday. But through this story, Ethan, the beautiful, lovable, cuddly, blue-eyed blonde, who never knew anything but love, has touched more people in his very short life than I will ever touch in my very long one. So in honor of Ethan, whenever I'm given the chance, I continually ask everyone to be an organ donor. And if they already are one, I ask them to spread the word. Organ donation can make all the difference, not only to the recipients, but also to the grieving, heartbroken family. It certainly doesn't take away the pain, but it softens the sorrow and lightens the darkness. So thank you, and please keep that story in mind.
Carol, thank you for sharing that compassionate story. And I know that Bob, we're getting support everywhere, which is great. I know that Bob was sharing that he really wants to thank his donor. And it is that other side where people who've lost loved ones, but having that connection with someone who's living on with those organs is really wonderful. So Carol, thank you so much for sharing that story. I do want to say a few things, and that we encourage everyone to register as an organ donor, no matter if you're in your teens, if you're in your 20s, if you're in your 30s, if you're in your 40s, if you're in your 50s, if you're in the 60s, if you're in the 70s, if you're in the 80s, or if you're in the 90s. There is no age limit to registering as an organ donor. And as I said, there are so many people sadly dying. 19 people die each day waiting for a transplant, then even not a perfect organ is going to be better than a failing organ. So the idea of registering, providing hope, is a very important one. We in New England are very focused on data. We're very focused on metrics. We're very focused on collaboration, working with municipalities, working with cities, working with the state, working with the federal government, working with the mayor, working with the governor, working with the president to help be progressive in making sure that organ donation is something that everyone can do. I'm so pleased to introduce one of the best hires. I thought I was a good hire. One of the best hires that we've had in many years, Dr. Jim Rodrigue, who's one of the foremost researchers in the country and teaches at Harvard. Jim, thank you so much for saying a few words. Really appreciate that.
Thanks, Matt. As you've heard, life-saving organ transplant is really a team sport. You have the child or the adult who's in need of a transplant. You have their family members, caregivers who care for them through the process. You have physicians and surgeons who perform the transplant and take care of the patient. But perhaps the most valuable player on this team is all of us, the general public. For it's our willingness to give hope to these patients by signing up to be a registered donor that moves this team along, that allows children and adults to live a fulfilling life in the face of deteriorating chronic illness. So I ask you, I beg you, please, to consider registering as an organ donor. As Matt said, you're very unlikely to become an organ donor in your lifetime. But what it does for those who are waiting and for their families is offer some hope for them that they'll receive this life-saving gift. As Matt also noted, we have 4,000 people in Massachusetts waiting for a transplant. Thanks to the great work of New England Donor Services, about 900 of them will receive a transplant this year. But 250 or so will die while waiting or will be removed from the transplant list because they're too sick. So let's give them all some hope by getting a heart on your driver's license and sign up to be a registered organ and tissue donor. Thank you.
Jim, thank you so much for your work and your leadership on this. I will note that Jim is an award-winning softball coach, so the sports reference I got. Nicely done. But it is true. This is something we can all do. We stand apart from every other major disease, COVID, cancer, AIDS, etc., in two big ways. We're not searching for a cure. We know what that cure is, and that is to utilize an organ that someone is no longer using and to have it recycled to someone else who could use it. And the number two thing, even though we are a nonprofit organization, when we talk about donation, we're not talking about a financial donation. We're talking about you registering as a donor. And that is to provide hope. But Mayor, thank you again for having this wonderful event. I do, again, want to feature and thank the state of Massachusetts, the governor who does a wonderful job, the legislature that does a wonderful job, specifically the Massachusetts Department of Public Health, and the RMV who helped fund this wonderful event through the support of a voluntary checkoff on the RMV application. This is supported by individuals' voluntary donation to support that. And again, we have one in Revere, several in Springfield and throughout the state. Educating people about it, hearing stories, the heartfelt stories of people personally touched, it is what causes action. So please consider registering as an organ donor. And again, Mayor, thank you so much for being here. We do have a flag raising, which is fantastic over here. But before we do that, again, Mayor, thank you for having City Hall come down here to listen to it. And again, because of stats, and I love the idea that Massachusetts is going to be a leader. I would love the region. Nationally would be great. These are large numbers. Massachusetts right now is under the 50% registration threshold. There are many states, Colorado, 62 perhaps, are there. We just want tick up to get to the 50% and over that. We can do that. We are the Bay State. We are the leader intellectually. We are the leader with our hands. This is a public health issue we can all take advantage of. So through your words of becoming a leader, I appreciate that. And asking that question, everyone who comes would be wonderful. So before we move over, and I know Israel is going to help raise the flag, I would love a group photo. Being in the photo doesn't mean you're a registered donor, means you're at the event celebrating this. So what we're going to do is we're going to pivot here. If everyone here can come and stand on these stairs, that would be wonderful, and we'll do a quick picture. The other last thing I want to say is that if a tree falls in the forest, does it make a sound? It does if there's someone there to capture that. And I want to thank the fantastic local media of Lynn. And local media is where it's about. People in their community want to know what's going on in their community, and you guys featuring that is a great value. So thank you for recording it. Thank you for writing about it. Appreciate your time here.